Okay, so now we look at the which of the following has higher intellectual sensory area. Wernicke's area is the higher intellectual sensory area. Lymphatic drainage from anterior face and chin goes into submandibular lymph nodes. Lymphatic drainage can go into submandibular lymph nodes from anterior face. Chromosomal abnormality was thought by Professor Sunkart long bone deformity marker. Which gene suppressor gene has a long bone deformity? That is retinoblastoma 1 gene. Next one is a patient is blindfolded, asked to identify the structure in the hand for the assessment being done. That is superior parietal lobe. Next question is a patient is present with cardiac facial corneal along with hypotonia, failure to thrive. Zellweger syndrome is accumulation of long chain of fatty acid caused by peroxisome deficiency in Zellweger syndrome. Peroxisome deficiency results into these type of the findings. Next one is a patient present with peripheral tingling, numbness, diplopia, visual disturbance, and demyelination. Which disease can be there? Oligodendrocytes are involved. Another one is patient present with peripheral nerve diplopia, that is oligodendrocytes and multiple sclerosis. Increase in gastric emptying occurs with gastric distension. Answer is gastric distension. Which of the following is primary physiological change associated with alcohol consumption? There is increased extracellular fluid osmolarity with alcohol consumption. Lactic acid injection was given to the patient through IV. It will increase respiratory rate through chemoreceptor in the medulla. Lactic acidosis results into hyperventilation through chemoreceptors present in the medulla. Next is a patient present with boils and perineal area, anal gland enlarged, rupture of boil, eroding lateral wall, lead to spread of pus into rectal fossa. Next one is mode is defined as most repeated value mode. Left circumflex artery occluded on angiography is period noticed by doctor. Area damaged will be left atrium and left ventricle. A girl spilled hot water, developed bully, burn hours after burns, later erythema, fever, dermis and epidermis is involved. What type of inflammation is it? It is serous type of inflammation. Serous inflammation results into this type of the burns and bull formation. A patient had injury of C5 and C6 vertebra. Which nerve will be affected? That is C6 will be affected. A patient present with chorea, hypotonia, mental retardation, decreased memory and depression, depressive mood disorder of single gene inheritance. That is Huntington disease is disorder of single gene inheritance. Another one is coronary sinus develops from left horn of sinus venosus. Coronary sinus. CSF flow blockade results into dilation of the ventricle, leads to hydrocephalus. What is affected? It is transcellular fluid is affected in CSF flow blockade.